welcome to my channel. This is Health with Dr. Ataria. If you're new to this channel, please subscribe and like our page. So today we're going to be talking about chlamydia. Chlamydia is the most common sexually transmitted infection affecting both male and female worldwide. It's very important and it's caused by an organism, a bacteria called Chlamydia trachomatis. So today we're going to be talking about the risk factors, the symptoms you can present with, and how to treat. But this video is not an avenue for you not to see a doctor if you think you have chlamydia. The first person you need to go see is your practitioner for full diagnosis and treatment. So while chlamydia, one fact about chlamydia is that the symptoms are more common in men than females. So most females are asymptomatic. You might not know that you have chlamydia. So it's good if you have multiple sexual partners for you to go test for chlamydia every year at least once. So what are the risk factors? The risk factors for chlamydia are having sex with multiple sexual partners and don't using protective measures like the condom to protect yourself against infections. So these are common ways of transmitting chlamydia, and also by contact. And when I mean contact, I don't mean you touching somebody that has chlamydia. What I mean is if you have chlamydia and then you touch the fluid, the secretion of your genital parts, and then you touch your eyes or any other part like the birth canal, the child coming out from the birth canal, that's also another way of transmitting chlamydia from a woman to her child. So these are the common ways, and the sexual intercourse, chlamydia can be transmitted via vaginal sex, anal sex, and even oral sex. So what are the symptoms that chlamydia presents with? Now for men, you can present with discharge, a mucus or purulent discharge from the penis. You can present with painful urination, which is commonly known as dysuria. You can also present with increased urination, which is known as frequency. This is because the chlamydia irritates the genital parts and leads to what they call inflammation. It can ascend from the penis up to the prostate. Chlamydia can extend to the bladder, so depending on where it gets to. So what about the females? How does chlamydia present? Most importantly, you need to know that in females, 80% of females who have chlamydia are asymptomatic, so you might not even know. Other signs and symptoms include dysuria, that is painful urination, frequency, just like the men, and also it can present with a discharge. It can be mucus or mucopurulent discharge. Chlamydia can also present in women as an ascending infection. It can cause pain when it gets to the cervix. When it ascends to the cervix, it can cause pain during sexual intercourse because of the inflammation. It can also cause bleeding, probably after having sex, or even intermenstrual bleeding after you've menstruated. Before you get to your normal menstrual period, you can bleed again. Chlamydia can also present with painful sexual intercourse that we've mentioned before. And if it ascends, it can lead to what they call PID, pelvic inflammatory disease, which is a very serious complication of chlamydia. So what are the complications of chlamydia if it's so serious? Now, if an individual who has chlamydia presents with the discharge from the penis or the vulva, the vagina rather, and then you touch your secretions, so mistakenly you touch your eyes, you scratch your eyes, you can transmit the bacteria from your vagina or your penis to your eyes, and it can lead to what is called conjunctivitis because it irritates the conjunctiva of the eye. And if it keeps moving down the conjunctiva, it can get to where the black is of the eye. That is called the pupil. And when it gets to that place, it causes what is commonly known as trachoma, which is a leading cause of blindness, especially in the developing world. And when you have trachoma, the black part of your eye becomes white. It causes an opacity, and then it might prevent you from seeing properly. Chlamydia can also involve the joint, leading to what is called reactive arthritis. So you can see chlamydia is very serious when it gets very severe. There's a syndrome called Reiter syndrome, and it consists of 3 components. An individual who has chlamydia that has Reiter syndrome can't pee, can't see, and can't walk. So can't see means trachoma, can't pee means urethritis or dysuria, can't walk, reactive arthritis. So you can see chlamydia can cause serious complications if not treated. So if you feel you have these symptoms of chlamydia, you should go see your doctor for proper diagnosis. So how do you diagnose chlamydia? Now, diagnosis can be done using swab. You can take a swab or urine specimen. Now, how is the urine collected? So you don't make a mistake when collecting this urine and you want to see your doctor. It's called a first catch. Clean first catch, meaning the first urine that comes out from your urethra. You don't have to urinate first before putting the sample bottle to get your urine. You get the first sample first, and then you lock the bottle tight. Or use a cotton swab, and then you take a sample from your vagina or your penis. So the tests that are done, the most common one, which is very fast and very accurate, is called the NAT test, which is known as nucleic acid amplification test, and it's very rapid and gives a very good diagnosis of chlamydia. Other ones that are done are culture, but culturing chlamydia takes time, takes up to 5 days before the results are out. You can also do a gram stain for chlamydia, but these are less effective methods of testing. So how is chlamydia treated? After talking about all the signs and symptoms and everything, basically chlamydia is a bacteria, so of course we have to treat it with an antibiotic. Tablet azithromycin, 1 gram. Azithromycin comes in 500 milligrams, so 2 tablets, 1 gram. That is it. That is all that is needed to treat chlamydia. You don't need any extra medication. Now, if you react to chlamydia in the sense that if you react to azithromycin in the sense that you have serious nausea or vomiting, especially in the pregnant women, you might not go for azithromycin. You might go for other antibiotics like tabs doxycycline, 100 milligrams, twice daily for 7 days. For pregnant women, doxycycline is not advised, so preferably use tabs amoxicillin 500 milligrams 3 times daily for 7 days. So other second line regimens are tabs levofloxacin 500 milligrams daily 7 days, or you can use tabs of fluoxetine 300 milligrams twice daily for 7 days. So that's all we have for you. So my advice is, whenever you're having sexual intercourse, always use protection, especially if you have multiple sexual partners or you're changing from one partner to another. Thank you. Don't forget to like our page, share, and then comment below. If you've had chlamydia or you know anybody that have chlamydia, you can share your story with us and we can discuss it. Thank you so much. Bye.